Have we started? Brilliant. Apologies to everybody. Just checking that we have started this webinar. Today we are covering your ultimate A to Z guide on how to carry out your health and safety COVID-19 risk assessment. So today I'm going to be talking to you about working safely in the workplace, getting your workforce back into work, and going through the an actual step-by-step guide in going through the health and safety risk assessment. We know that the government has issued numerous guidance on how to address these various risk assessments, and to make sure that you've got access and copies to that. We will make sure that those links are sent to you as soon as we can. So today's webinar, as I say, is your ultimate A to Z guide on completing that COVID-19 risk assessment. I'm Angela Clay, and today is Wednesday, the 17th of June 2020. This is a recorded webinar. It's unfortunately not a live one, so if you are going to be putting those questions into the question box, they probably won't get answered. But what I would recommend that you do, if you do have any questions, drop us an email at info@hrforuk.com, or you can go to our website, which is www.hrforuk, and fill out a form and somebody will get back in contact with you. Or of course you can give us a call on 01455 444 222 and speak to one of my colleagues, and we'll be able to put you in the right direction. So today, you know, as I said, I'm Angela Clay, and I'm Managing Director from HR4UK. So for those of you who don't know, who are HR4UK? So HR4UK is a leading provider of HR and employment law support, as well as payroll and pensions, as well as the ultimate health and safety services. We've got over 30 years of experience, and we've got some fantastic 5-star reviews on our website, and I would strongly encourage you to go and have a look at our website, read those reviews for yourself to see what our clients have said about the services that they've received from us. So again, our website is www.hrforuk.com. So I'm Angela Clay. As an employment law solicitor and Managing Director, I'm responsible for HR4UK's role in leading professional HR services and providing that all-important support and guidance to UK businesses across the nation. So my vision has been, and it has been right from day one, is to successfully come out of this crisis together by offering you clear, professional, practical support and guidance, no matter what the issue may be that your business is facing, whether it be a health and safety issue or whether it be an employment law issue. My vision is to help you to get out of this, because what we need is to make sure that businesses are successful to be able to continue to support the economy. So again, as I mentioned earlier, this is a recorded message. Normally I would be asking you to pop those questions into the question box, but please do send us your questions. Your questions are important to us, because not only does it help us help you, but it also gives us an idea of what sort of questions you may have that we haven't covered, because I want to make sure that these webinars are suitable for what you want, and of course it helps us to give you what you need in the future. So if you want to pop in a question, don't use the question bar, but email us at www.hrforuk.com and complete a form, or you can do it the old-fashioned way through an email, which is info@hrforuk.com. Don't worry about making notes on this webinar. We are going to, it is a recording, so you will get a copy of this recording in the next couple of days. You will also get the download for the template risk assessment that I am going to be going through. You will also get those links to the government guidance in relation to the settings that they have gone through and issued those guidance. So don't worry, they will all be coming to you. So let's have a look at your ultimate guide to the COVID-19 risk assessment. Many businesses are now starting to reopen, and actually a lot of businesses are open. There are lots of changes that have been implemented. There are some businesses that have been open and remained open throughout lockdown and have had to implement a lot of changes. As I say, the government has issued guidance. The guidance that has been issued is in relation to different work settings, for example, outdoors, construction sites. They've had a look at factories, they've had a look at takeaways. We know at the moment, at the time of recording this webinar, that restaurants are still not open. We still don't have hotels that are open, but I should imagine that once we are ready to open those, specific guidance will come out. We are always updating our website, and those guidances will be there, or a signpost as to where you can find them will be there. So do have a look and find where you can find it. The guidance also includes people who are in vehicles, offices, and also for people working in other people's homes. As I said, those links will be sent out to you, so don't worry, or where am I going to find those? But what businesses do need to do is they need to develop best practices for the safest ways in working, to providing people with a confidence that it is safe for them to return to work, and actually now is the time for them to start returning to work. Every business has to adopt a considered, safe, and perhaps a phased return to work. We do have the flexible furlough scheme, which is coming into effect from the 1st of July, and it's really another means of the business, of the government supporting businesses, of getting them back into work. But businesses need to plan now, if you are, back into work or are still planning to get back into work, on what your business looks like now, because what it looked like before lockdown is going to be a very different operating procedure is what you have now. It doesn't matter what setting you are in, it has changed. And with this in mind, you have to think about the risks that are in your organization. Every single business has to carry out a COVID-19 risk assessment. You will all know that prior to this, that obligation was only if you had 5 employees or more. That is no longer the case in terms of COVID-19 risk assessment. Your usual health and safety obligations are still there. You still need to carry out those, but this is specifically in relation to COVID-19. So when carrying out a risk, you need to have a look at the practical steps that you're going to put in place. You must have a look at how you're going to implement that. Obviously, you should do it as soon as possible, and ensure that you've got a roadmap, that your staff are aware on what journey you are taking them on to get them back into full-time work. When carrying out the risk assessment, you need to assess that risk. And of course, that risk that I'm talking about is the risk of infection, and it's the risk of transmitting that infection. And that infection, of course, is of the coronavirus. So when assessing that risk, have a look at the activities or the situations that might cause that transmission or the infection. So think about what that could be in your workplace. Decide how likely one of your employees or anybody entering into your workplace could be exposed to that risk. And then have a look at what activities can be removed, or what steps that can be put in place to limit or to mitigate that risk. So again, it's going to vary from one business to another. It may well even be from one office space to another office space, and I'm going to talk you through sort of some things that we can still have a look at, and I'm going to cover a couple of reminders and just pointers that I have covered on previous webinars, but it's quite important just to recap on those, just to remind you what you should be doing. So the guidance still is, if it is not possible to have all your employees at home, if possible, still let staff work from home. So working from home is still an important part of keeping your business going. So all reasonable steps should be taken to help people work from home. But those who cannot work from home should be able to come back to work. And employers should actively be getting staff back into the workplace. There is no longer the requirement or the need to say you have to stay at home. And I think that is an indication of the change in the furlough scheme by introducing that flexible working. So you can still have that support from the government, but you can also get staff back into work. Carry out that COVID-19 risk assessment. Consult with trade unions if you have a trade union that you recognise, or if you have staff representatives. Start talking to them about what that risk assessment is going to look like. I am going to go into a lot more detail about that COVID-19 risk assessment, but it's about making sure that you carry out the process and you share it with your staff and get ideas from them, because they might come up with some really good suggestions that you may not have thought about. Every business is different. It is not a one-size-fits-all, but what we can provide you is guidance to get there. And of course, we have the health and safety advice line. So do get in contact if you have any questions about it. So once you've carried out your risk assessment and you have shared that with your employees, you should publish those results on your website if you've got 50 employees or more. Businesses with 5 employees or more should in any event document that risk assessment. But best practice is it actually doesn't matter what size of your organization, you should have that information readily available. And particularly in light of COVID-19, I think it is really important that that information is readily available and shared. There's no need to hide any of the information because everybody is going to be in the same situation. Do remember that the risk assessments must be carried out before staff come back to work. So before you start getting your majority of your workforce back in, many of you have probably got a skeleton staff running at the moment, make sure that the risk assessments are continually reviewed. So if you are getting that full workforce back in, under the flexible scheme or under normal work circumstances, make sure that that risk assessment is carried out before staff come back. Again, we know that there has been a lot of discussion about the 2-meter social distancing, certainly at the time of making this recording. The 2-meter rule still exists in the UK. So employers should perhaps consider redesigning the workplace to maintain that 2-meter social distancing. We have seen it in a number of places where we are going into, where desks next to each other have been cordoned off and marked as don't use. We've seen it in shopping centres that are now opening, where normal seating arrangements, places where you could rest up, have now been closed off to encourage that social distancing of 2 meters. And you need to think about your floor plan, think about your individual workplace. And it might be appropriate for you to create a one-way system, walkthroughs, having different entrances to exits, changing seating layouts, and also, of course, considering starting and finish times, so staggering the start and finish times to reduce the number of people in one confined place at a time. But of course, keeping that 2-meter social distancing may not always be possible. So what you have to do in those circumstances is manage that transmission risk. So again, it's managing how it is going to happen. So you might want to have a look at putting barriers in shared places, creating a shift pattern similar to what I've talked about before. You might want to have fixed teams. So what I mean by fixed teams is having the same people working together at the same times. So whereas you might have a phased, a flexible shift pattern before, you might want to lock that down into the fixed team. So you're going to work with these fixed people for a fixed period of time. So again, it's reducing that risk of transmission. Again, we know that working side by side or back to back is the best practice. Try and avoid face-to-face working or consultation meeting with people. And it's just putting measures in place to try and encourage that where the 2-meter social distancing is not possible, there are other measures that are put into place. Have a look at your cleaning, reinforce your cleaning habits. Some businesses only require cleaning in pre-lockdown times, perhaps once a week. You might need to reconsider that and making those cleaning of your office space, your workplace, more frequent. So have a look at the frequency of cleaning. Make sure that key attention is had to high contact objects, contact places where people go to. So for example, door handles, that is a contact place that gets touched quite regularly. So of course the cleaning on that should be more frequent than what you would perhaps have in a place where somebody might go maybe once a day, or perhaps only once a week. So again, having a look at those frequently used places. Keyboards is another area that would require frequent cleaning. Photocopiers. Kitchens, kitchens are, we all go to the kitchen for a good old cup of tea, or a cup of coffee, or water, whatever it is. That is going to be an area where there's going to be lots of people going in, and where that contact is going to be. And I've got a frog in my throat, so if you bear with me one moment, I'm just going to have a quick drink of water so I don't choke on you. Apologies about that. I was thinking about that cup of tea, and suddenly my throat was saying, oh yes, I'll have a cup of tea. But in all seriousness, having a look at those high contact areas and making sure that the appropriate cleaning measures are put in place. It may well be that due to the areas that you need, it might not need to be as frequent as as other areas, but every area needs to be assessed and the appropriate steps need to be put in place. Hand washing facilities, make sure that there are hand sanitizers available, and make sure that these are both at entry points and exit points. Make sure that in washrooms that you have disposable drying facilities. Again, if you traditionally had hand towels, replace those with single-use paper towels, and have a process in place on how to dispose of those paper towels. There are plenty of downloadable notices that you can use that can be displayed within the workplace as reminders, not only to staff, but to any visitors that you are going to be having into your workplace. You might have customers, you might have clients coming in, you might have visitors, contractors, maintenance people. So again, having those visual displays of what you have got in place and what measures you've got in place can be easily followed at a glance, and without people having to sort of really look into that. So think about who should be going into work and make the appropriate changes for everybody. So we've talked about very broadly about what you need to do. Let's have a look at a couple of strategies, and I'm going to have a look at some specific details. Again, this is just a guide, but if you take a step back and you take a bird's eye view of your organization, if you apply the same principles of what I'm going to be talking about today, you will be going a long way in going down the right pathway. So whether it is an office space, whether it is a factory, the principles will remain the same. So again, I've talked about this before, and I can't stress the importance of engaging with your workforce. Talk to your staff about working safely, consult with them, involve them in getting it right, because you are more likely to have staff coming back to work, getting rid of that problem of resistant staff members, because you have shared that information with them. It's really, really important, and everybody has to take personal responsibility in limiting that risk of COVID-19, both the spread and the transmission of it. Transmission and spread is probably the same word, but you know what I mean. So every workplace is different, but as I said, the principles are the same. So let's have a look at office premises. Let's have a look at some of the measures that you can put in place to combat the spread of the virus. So we've touched on cleaning. So review those cleaning practices. Do you need to have a deep clean? Have you had a deep clean? And when is the next time that you are going to plan a deep clean? Because you may already have people within your workplace, but again, over time, there is going to be the usual sort of build up of grime, muck that goes on in a normal workplace. But you may historically have only had a deep clean perhaps once a year. You might want to increase that frequency. So have a look at what your current cleaning arrangements are and see what measures you need to place to perhaps change it to more regular cleaning measures. It can be difficult to prevent respiratory infections. We're lucky at the moment, we're in the summer, but we do know that perhaps we are going to have different difficulties that we face in the winter times when we've got ordinary colds and we've got ordinary respiratory conditions that may be lurking around. So again, those measures are not just for the here and now, they are to future-proof your business. So, you know, we know, and I've talked about it, that the way that we can prevent that spread is by limiting the proximity to an infected person. We don't always know when somebody is affected. We know what those symptoms are, but there might be a period where actually we don't know that we're infected when we are. But that is why it is so important to maintain that 2-meter distancing. We also know that there are circumstances where someone touches another person or an object which has those respiratory droplets containing the virus on them, you know, so perhaps from coughing or sneezing, then rubbing your nose, your eyes. It's a natural reaction. We all have that itchy nose or those itchy eyes, but we don't necessarily think of, oh, what have I touched before? Because it is an automatic response that we have. So again, it's like looking at those and making sure that we limit that transmission. So like any other workplace hazard, COVID-19 risk assessments must be carried out. The likelihood of employees contracting COVID-19 at work and what measures you have got in place to control those risks. Taking steps to ensure good hygiene will go a long way. Hygiene is really important, and those measures that you put in place are equally as important in maintaining that. Again, if you haven't got a health and safety COVID-19 specific policy, I think you should implement one. If you are looking to have one, contact us. HR for UK does have a health and safety COVID-19 health and safety specific policy. It should sit alongside your existing health and safety policy because, of course, it deals with the specifics of COVID-19. If you're a client of ours, it will be, and you are on the intermediate level or you are on the upper level, it will automatically be uploaded into your handbook. If you are one of the clients who are on the basic level, do get in contact with us so that we can talk about upgrading you to the next level so that you can have that COVID-19 health and safety health and safety policy. So again, we've talked about hygiene, so let's have a little further look into that. Hand washing, staff should be encouraged to wash their hands frequently and for at least 20 seconds. We've talked about you know, having those hand drying facilities, having those paper towels rather than hand towels, and again making sure that there is sanitizing gel that is easily accessible for staff, visitors, clients to use. Make sure you've got tissues around the organisation that is easily to access. You know, make sure that it's all fine and well having boxes of tissues around, but let's make sure that we can actually get one out when we need to. Make sure that staff, visitors, customers, anybody who is coming to your premises are aware of the advice on how to sneeze, how to cough. We saw loads of this coming out when we first went into lockdown, but I think a lot of us have already forgotten about it. So it's a good reminder just to remind people on how to actually, you know, dispose of the tissue that they have just used if they've coughed or sneezed into it. And this is really, you know, it might sound obvious, but people forget. So having those signs up, you know, there are downloadable signs from the government website, and again, I will send those links to you, where you can actually simply print these off and just, you know, have them posted up around the workplace. Again, sharing equipment, discourage staff from sharing equipment. Of course, if you do have to share equipment, make sure that you've got antibacterial wipes at the start and the finish times of using it. Shaking hands. I can't remember when last I shook hands with anybody, let alone give my loved ones a hug. I don't think it's appropriate to be giving anybody a hug in the workplace, but it is still common practice to do a handshake. We know that handshaking is something that we will probably look back on and not to do again. So again, it's important to remind staff, customers, clients who are possibly coming into your workplace, that we are not, going to be doing handshakes. And again, a simple way to communicate that is by having a notice up to say, we are not going to be doing handshakes and the reasons why. Again, it might be obvious, but our brains are instilled in doing things, and it's a natural reaction. So just having those reminders around the workplace, will help prevent that transmission. I've talked about the social distancing, so I'm not going to, go on that anymore. If you do want specific guidance on that, do get in contact. We'll be more than happy to help. We will help talk you through ways that you can perhaps put measures in place if those 2 meters social distancing can't, if you can't comply with it. So do get in touch, so that we can help you, because help is there. You don't have to fight. You don't have to do this on your own. This is something that is going to be a shared responsibility, not only for as business owners or people managing workplaces. It is also the responsibility of those going into your workplace, who has a responsibility to make sure that we take all steps and measures to prevent the risk of COVID-19. As I said really early on, employers must still fulfill their usual health and safety duties during lockdown as well as beyond. So COVID-19 risk assessment is just another layer of that. Don't forget about your other health and safety risks, trip hazards, Legionellas, disease in terms of water systems. They still need to be carried out, as well as fire risk assessments. And those are just to name a few. Really don't forget about your other health and safety duties and obligations. So just a quick reminder, I talked about disposing of those tissues. There are specific guidance on that, and for your help, I'm going to just go over that again. So in terms of disposing rubbish, particularly those who, tissues are a prime sort of example of that. If someone is suspected of having COVID-19 and they've been in your workplace, they start displaying the symptoms, high temperature, a cough, the usual symptoms, that we've talked about before, that those are the 2 sort of that you will see from a starting point. If you suspect that someone in your workplace has had COVID-19, make sure that you dispose of their tissues or anything that they've touched in a bin bag. Tie it, put it in a second bin bag, tie it, label it up that this has potentially got suspected COVID-19, the coronavirus in it, and store it. Wait until you get the results of the test. If the test comes back negative, you can simply throw it away as normal. If, however, the test comes back positive, you should get in contact with the local health protection team, who will tell you how to deal with that, how to dispose of that waste disposal in the correct and proper way. So again, if you suspect an individual of having the symptoms, keep the disposed waste, make sure you mark it up. If they are clear, throw it away in the normal way. If it is a confirmed case of a positive test, then contact your local health protection team, who will help and guide you on how to do that. So I think that's a good recap on everything. I'm now going to turn specifically to the return to work COVID-19 risk assessment. It is a downloadable document. It is a template. It is something to use as a template. Every workplace will be different. So again, this is a guide, and you will need to get specific help and support if there is something that you are not sure of. The Return to Work COVID-19 Risk Assessment is downloadable, and it is coming to you as this package with this particular webinar. So again, it'll come to you. If you haven't got it already, of course you wouldn't have it. You may have downloaded it from our website before. Don't worry, I'm going to talk you through it, and I'm going to tell you how to go through it. So just a really, I can't stress enough, this is a template. Health warning coming to you. This webinar should not be substituted for taking proper support and guidance from a health and safety expert. It's really important. Don't treat this as your get out of jail free card. this is meant purely to help and support you. We can help you. Please don't struggle on your own. It might be a question, it might be a simple question. You know, don't feel that it feels like this is going to be a silly question. No question is silly. Do ask, rather have that peace of mind in knowing that you have sought advice and you have acted appropriately. So don't struggle on your own. There is help available to you. So let's have a look at this risk assessment. It must be adapted to your business, okay, because every organization is going to be different. And again, you must constantly review it. It is it's a live working document. It must constantly be reviewed. It must be constantly updated. If anything in your organization changes, you should go back to your risk assessment and see if any other changes need to be made and implemented. So again, as I say, it is a live working document. It's breathing. You should give it life. Make sure that it's not one of those documents that you complete at the beginning, you forget about it, and in a couple of months, possibly years, you dust it off and you blow off the layers of dust that have collected on it. You know, that's really not advised, and it should be constantly under review. So let's have a look at the actual document yourself. So at the top, the starting point is the site address, the name and the location. So where is the risk assessment actually being carried out? So have a look, put it in there, state the place where it is being you know, carried out. So I'm going to use HR for UK as an example. So the information that I would be putting in that box would be our address. That would be the 2nd floor, St Mary's House. No, it's not. It's the 2nd floor, Florence House, St Mary's Road, Hinckley. So again, describing the address, describing the location, putting that information in there. So we know that this risk assessment applies to HR for UK specifically and where that location is. If you are carrying out a risk assessment and it applies across a number of locations, so for example, if you have got you know, 2 sites, you can use the same risk assessment for both sites. But what you have to do is make sure that you actually have both sites and locations in that risk assessment. So anybody looking at it will know, this applies to this location as well as that location. And if there are different measures that are being put in place, you can actually differentiate that in the document. So as I work through the document, you know, think about your organization, take a bird's eye view, and let's go through it. So we've looked at the location and we've put it in that box. If it's one location, great. If it's multiple locations, make sure that you ensure that all the locations that it is applicable to is in that box. So looking a little further down, so who is assessing and carrying out the risk assessment? Who is that individual? Is it someone within your organization, or have you engaged the services of a competent health and safety expert? So again, who is assessing that your risk assessment? Put a name in. If it is an organization, make sure you put that organization's name in. Make sure you put the name of the person who is carrying out that risk assessment. So if, for example, in HR for UK, I am carrying out that risk assessment, I will be putting my name in there so that anybody who is picking up this document will be able to see who carried out the risk assessment. As I said, if it is another organization, they know who to contact should the need arise, if they have any questions arising out of it. So who is the assessor? Put a name. If it's an organization, state who it is. Job title. It's really important to have what the job title is, particularly if it is an external individual who is carrying out the assessment. There is no requirement for you to outsource this. It can be done by somebody within your organization. A competent person is defined in the health and safety legislation, and it is someone who has the capacity to be able to carry out the assessment. You don't need a qualification, a specific health and safety qualification to be able to carry out the risk assessment. If you would prefer somebody who has a qualification to do it, of course it can be outsourced, but there is no legal requirement for you to do that. Obviously, there is a signature place. We want to make sure that the person who has carried out the risk assessment is going to put their stamp on it. They are going to be confident and comfortable that what they have put in the document, they can stand by it. Hand on heart, this is what the situation is. So there is no reason why they can withhold putting their signature on it. And of course, a date. When is this risk assessment actually carried out? It's the date the risk assessment is done. Don't try and put a fictitious date in there because it will catch you out. Today's date, the day you carry out the risk assessment, is the date that you put in. So the next couple of lines on the risk assessment is, as I said to you, it is a live working document. So the last assessment date, so as we progress with this, it will be the time it was previously done. So if, for example, I'm carrying out the risk assessment today, the 17th of June, 2020, when I'm carrying out a review of the risk assessment, the last assessment date, and again, I think I've missed a box there, so I'll come back to it. The last assessment date will be that 17th of June 2020. It will not be any other date, so it'll be the date that the last assessment will be done. Who was the last assessment carried out by? It may be somebody else. So for example, I may have carried out my risk assessment on this occasion, which would have been my assessor details, which have been in the previous box, but I might, for example, get my operations director to carry out the next assessment, or perhaps I get my office manager to carry out the next assessment, or I might even take the decision that actually I need someone else to do this and I outsource it. So again, it's who's carried out the assessment. It put a name to it, put a date to it, and always look at what that review date is going to be. When will this next need to be reviewed? Is it 3 months? Is it 6 months? Is it 12 months? So again, it's taking a view when that next assessment needs to be done. This is all about record keeping. As I mentioned earlier on, this is a live reading document, and it is you should be reviewing it regularly, and so if you are ever challenged on any of your health and safety risk assessments, particularly in terms of COVID-19, you will be able to show that you have done it. There is an audit trail. If you're just going to leave this document to collect dust on the side, it's going to be no good to help you if you are ever challenged. So again, record keeping is absolutely key. Make sure, even if at the moment you are reviewing this on a monthly basis, as things and lockdown is lifted and you get more and more people coming back into your workforce, make sure you document it, because you're not going to remember in 12 months' time who carried out the review, when it was carried down, and if you are challenged, it will be hard pressed for you to try and remember. Whereas if it is updated on a regular basis, you won't be left caught short. So again, let's have a look at the assessment. What is the assessment based? So describe the property. So early on, we put an address. When we are looking at the assessment based on the property description is not the address, okay? The property description is, it's a freehold building. It's a shared building. It is a shop front. It is a factory floor. It is an open plan office. So describe the area that you are carrying out the risk assessment for. There may be multiple areas. So it may well be we are in a shared building. It is an open plan, but we also have closed office sections. So again, it's giving a detailed description of the property that has been assessed. It's not the address, it is what the actual environment is that you are assessing. So again, once we start having a look a little further down, so we need to have a look at who is at risk. So we're specifically talking about COVID-19 here. This is not a normal risk assessment. This is a COVID-19 return to work risk assessment. So who is going to be actually coming into your workplace? So we know it's going to be staff. So of course, staff, employees is an obvious starting point. What about contractors? Are you going to be expecting contractors coming into your workplace? Now, this might be maintenance people. This might be regular maintenance, it might be building maintenance, it might be someone who comes in once a year, it might be annual inspections, it might be weekly inspections. So think about who is going to be coming into your workplace. Are you open to customers? Are you open to visitors? Those visitors being clients. Are you open to people doing a cold call coming into your offices? Is the general public going to be coming into your workplace? You know, so again, take a step back and think, who are the potential people likely to come into your workplace? As I said, this is a template document, so we have populated it with a couple of suggestions. So contractors, maintenance people, staff employees, general public and others. If there are other circumstances where you think somebody might come in, add it to the box. If you think that someone might come in, put it in. If you are going to be thinking and leaving it just as others, in the details box next to it, you might want to explain a little bit more what that's going to look like, okay? So who the people are at risk, if there's any specific details that you are going to need to add into it, put it in the details box. Consider the frequency. So how frequent are these people going to be coming into your workplace? So staff, again, it might be on a rotation basis. So in terms of the staffing, you would start as the starting point, your entire workforce. How many numbers, how many employees does that look like? Again, using HR for UK as an example, we've got 13 members of staff. So in the details section, I'll probably put 13. Frequency, when we are normally back up and running, it will be all 13 members of staff that will perhaps be in the business. But we also know that we've got some home workers, we have got some people who are field-based. So not all 13 members of staff are going to be in the office all the time. But in normal times, we will have that as 13. Of course, we're talking about COVID-19. We have got a reduced number of individuals who are coming into the office. At most, at the moment, we have a maximum of 4 people in the office. So again, we would be putting that frequency in and what that number is. Again, look at your contractors. So contractors might be coming in weekly. So if you have contracted your cleaning services, how often are they coming in? Are they coming in weekly? Are they coming in daily? Are they coming in monthly? Air conditioning maintenance, how often is that being done? So again, it's thinking about that granular detail. How frequently are they going to be coming in? And it's making a note of the frequency on what it is like now and what it's going to be like in normal times. So the benchmark should be, your starting point is, what was it like before we went into lockdown, and what is it like now, and what is it likely to be when we start easing and bringing people back into the workplace. Very, very important. Are any of those individuals disabled? Now, we're not just talking about physical disabilities. This is really important that you have given it some thought. Is there any likelihood of any known individuals coming into your workplace to be disabled? The physical disabilities are easy and obvious to spot, but don't ignore those silent disabilities, okay? Because if you do ignore them, it gives rise and it opens you up to risk, a risk of a discrimination claim. And I'm not talking about employment law discrimination claims, I'm talking about general discrimination claims, okay? So really have a look at that and be realistic about thinking about those silent disabilities. And of course, there's the comment box. So any comments, any information that you think will be relevant about the persons at risk, their details, frequency, disabilities, put it in the comments box. Because as I mentioned earlier, whilst I might be the person who started off with this risk assessment, I might not be the person who's going to continue with it. So document your thought process. This is a living, breathing document. Make sure that you document as much as what you can in the comments box. So look, let's take a look at the next step at completing this COVID-19 return to work risk assessment. There's 3 areas where we have covered, because of course the risk here that we are looking at is, what is the risk of COVID-19. So what are those factors, those exposures that you need to have a look at? So those exposures are living with someone who has a confirmed case of COVID-19, having come into close contact within 2 meters of someone with a confirmed case of COVID-19, and being advised by public health agency that a diagnosed case has occurred. So again, those are factors that you need to bear in mind. So looking at your workplace, we've broken that down. We've broken the risk assessment down into 3 sections. So the first section is factors causing the spread of the virus. The next factor that we have looked at is looking at your workplace premises. And the final section that we have broken down is workplace tasks. Now, I am going to go through the template. We have started populating it with areas of commonality. So it will be common in probably 99.9 organizations. You will have these starting points in your workplace. It is a starting point. You will need to take a bird's eye view of your own organization, and you will be able to add to the document where you think there is things that we haven't covered, because of course this is a template. It's to get you thinking about how to use this document. So let's have a look at the factors causing the spread. So again, if you're looking at the risk assessment, so we are looking at how is that spread going to occur. So we're having a look at contact with an infected person. So it's number 1 in the box. Again, we have used common risks that we think is going to be common, but again, as I said, it's got to be specific to your organization. You might think of others. So contact with an infected person. What measures have you currently got in place to combat that? So if you have a look at, so I'm going to be working from left to right on the document. I am on page 1 and I'm about 3/4 of the way down of the document. So we have got number 1 in the box, contact with infected contact with infected persons. So what existing controls have you got in place? Now, you probably don't have any if you haven't opened up your workplace. If you have continued to work throughout the lockdown, what have you got in there? Document what you have got in place at the moment. If you've got nothing, put nothing. If you have got something, put whatever it is you've got in there. Do bear in mind, there is no right or wrong answer. It's about looking at what you've got, what improvements you can make, and when it needs to be reviewed. So we know what we're looking at. We know what we've got currently in place. So how do we assess that risk? So you'll have a look in the box at the top there. We've got current risk. Okay, then you've got 3 little letters. We've got P, S, and R. So let's have a look at let's break that down as to what that means. So what is the probability with the measures that you've currently got in place of coming in contact with an infected person? Now, we don't have a crystal ball. You will need to have a look at in your organization, what is the probability of coming into contact? If you have nobody coming into your workplace, that risk is going to be low. If you have got a number of different people coming in from all different aspects coming into your organization, that risk is going to be higher. So when you have a look at the probability, so at the bottom of the page, you have got the probability and you have got a number next to it. So if it is very likely that you are going to come into contact with someone who has been infected, you need to give it a number 5. If it is unlikely that you are going to come into contact with somebody, give it a 1. If it's somewhere in between, give it the appropriate score. So let's use HR4UK as an example. And again, this is an example. It is unlikely that we will come into contact with someone coming into our organization. Our offices are closed to anybody else coming in. The only people who can come into our workplace are staff. We have minimal members of staff coming in. As I said earlier, we have a maximum of 4 people. So the likelihood is low. So I would put a 1 in the P box. As I said, if you've got other factors that are going to influence that, you need to scale that up. So what is the severity in the likelihood of me coming into contact with somebody? What is the severity of that infection likely to be? So that transmission risk. So again, using HR for UK as an example, the severity is probably going to be very low. So I would probably put a number 1 there. The risk is negligible. Okay, if I've got people traipsing in and out and that risk of that infection is much higher, you must put it as a high risk, particularly if you've got no current measures in place. So having a look at the current risk factor is you are going to take those 2 numbers and you're going to add them together. So again, in my example of a probability of 1, a severity of 1, I have come to a total of 2. So I'm going to have a look at that risk factor, and you're going to have a look at the bottom line. Between 0 and 8, the risk is low. So my current risk in HR for UK in coming in contact with an infected person is low. Okay. If your score is higher than that, so for example, when you're adding those 2 scores together and you come with anything between 9 and 15, you need to do something a little bit more than what you've currently got in place. If your scoring factor is between 16 and 25, stop what you are doing, close those doors, and let's put some measures in place, because you are at very high risk at coming into contact with an infected person. So once you've got that risk factor, the current risk factor in place, you can then have a look at what further measures you need to put in place. So it may well be that the risk factor is low. That doesn't mean you don't need to do anything. You still need to think about, is there any further measures that I need to put in place that's going to safeguard my workplace? If there is, jot it down. So for example, you might need to have a different, so again, I'm going to use HR for UK as an example. We have got sanitizer bottles on every single desk. Coming in this morning, I'm thinking, actually, I think we are low risk, but I think as we start getting people coming in and out, it might be useful to have a hand sanitizer station at the entry point. So that is possibly having a hand sanitizer container, self-disposing accessory where people can access it coming in and out of our offices. So that's a future measure or a further measure that I may want to implement. So again, moving along, what action is required? That again will depend on the risk factor. If you're at high risk and you're having to stop, there's probably lots of action points that need to go in there. If you are at medium risk, there will probably be a couple of action points going in there. And if you're low risk, there may well be some action points going in there. So what action is required to remedy, to put right what you haven't got? Now, helpfully, what is added to the risk assessment, if you go to the back of the risk assessment, it's probably around about page 8. There are pages and pages and pages of additional notes that will help you to see what I can do. So again, just going through them very briefly, there are some general notes on what you should be doing, what general action and steps you can be taking. There are links to different websites that you can go to. There is help and support in those notes sections. So again, when you are having a look and you're completing your risk assessment, don't forget about those all-important notes that are at the back of that document. They will help you immensely in making sure that the risk assessment that you are carrying out is fully considered. You've given it a lot of thought, you've done a little bit of research, and of course that all important help that we can provide you by getting in contact with us. So we know what we need to do. That's great, but we need to make sure that it actually happens. So we need to put a stamp on it. We need to put a date on it. We need to put a time frame and a time scale in when that is actually going to be carried out and when it's going to be completed by. Because of course we know that some of these things are going to take time to implement. We know that some of these things are going to require you getting additional resource. Again, using sanitizer as an example, you might need to order sanitizer gel. If you are getting sneeze screens put up, you need to have it ordered, you need to have it fitted out, you need to have all of that put in place. You might need to be implementing that one-way system. You know, you might need to be ordering tape to be able to, you know, tape it out, you know, marking out those 2-meter distancing. If you are going to be having a place where there is likely to be a queue, make sure that you have those, markers in place. You know, so again, those are things that need to be done. Who is going to do that? Put a name to it, put a date to it. It's about accountability and making sure that those action points are done. So once it's done and it's completed, you're going to risk assess it again. So you're going to go back to looking at what that new risk is. So hopefully, if you were in a medium or a high risk, you have downgraded that risk to either a low risk or a medium risk. So it is important that you carry out the assessment on what the risk factor is currently, as well as what that risk factor is once you have implemented those changes. And hopefully, as I say, that should then end up being a low risk because you have put and implemented those measures. It's not a race. It's not a race to get it all done all at once. It's going to take time, it needs to be measured, and it needs to be controlled, but it needs to be implemented. And again, it will be based on your individual circumstances of your workplace. So again, I'm not going to go across the risk assessment again, but what I am going to do is I'm now going to go down the risk assessment. As I said, if you are not sure, if you have any questions, do get in contact with us. We will be able to help you. So again, factors causing the spread of COVID-19, the virus, coronavirus, proximity to other staff and customers. So you might be having a customer-facing situation. You might be having an open plan office. So again, look at the proximity of people to people. This is specifically dealing with that social distancing. So when you go through the proximity to other staff, have that social distancing 2-meter rule in mind. Take a bird's eye view of what you've currently got, how you can implement that 2-meter social distancing, and what measures you need to put in place to ensure that you can comply with that. As I said earlier on, you may not necessarily be able to do it in every single circumstance, but it's putting other measures in place. So again, earlier on, I talked about the contamination of surfaces. I've talked about contamination of waste. Again, look at what those risks are. Look at what you've currently got in place. Risk assess it. Look at those future and further measures that you need to put in place. Get that action plan documented, bullet point what needs to be done, and assign it to someone. Make sure that there is a time scale and that it is actually completed, and then that risk assessment is carried out again. Looking at overcrowding, you know, overcrowding may be a situation that you may face in your workplace. That might be something where there is the risk of that spread of that coronavirus. You will see from the risk assessment there is some open boxes, so that is for you to carry on adding anything that you think where a situation may arise where you are having that contact where the spread of the virus might take effect. So for those of you who perhaps go into other people's homes, that would be something that you would need to assist and put measures in place. So it's not necessarily you know, just people coming into your organization. It's about looking at your staff and how is that coronavirus, that pesky coronavirus, going to be transmitted, and what can you do to prevent that spread? So it's maintaining, you know, mitigating that risk. So looking on, I think it's about page 3 on the risk assessment, we are now looking at the premises. So again, this is taking a bird's eye view. This is looking at common places on most workplaces where your premises will be. There will be others. I'm sure that there will be something that you will be able to add. Again, I'm not going to go through you know, through it on a specific line by line basis, but again, let's have a look. Take a visual mind's view on how your workplace premises actually look, because it will be different from one place to another. Every organization is going to have an exit, an entrance. You might have one entrance, which is an entrance and an exit. You might have 2 different entrances. You might have 2 different exits. You might have one entrance, one exit. So again, have a look at the entry point and the exit point. In the risk assessment, we've only worked at an entrance, but in reality, you might want to have a look at and have something else in terms of an exit. You might want to treat it as the same, so entrance and exit as the same if it's the same point. Again, look at those measures that you have got in place. You will probably notice it every time you go into a shop or a shopping centre. They've got that sanitizer station, so you will be drowning your hands in sanitizer. That would be ideal for any entrance or exit to your organization. Again, have a look at what is applicable for your specific organization. Staircases, it might be, so this is a common area where you would have in your workplace. You might not have stairs, in which case you don't need to worry and you can take that out, but you might have a staircase. So again, you will need to have a look at what measures have you got in place there. Now, it would be, and probably, it may not be, but it might be unreasonable to expect someone to use hand sanitizer gel every time they go up and down a staircase. But what you might need to consider is actually that is a frequently used area, in which case we need to have cleaning frequency improved. We might need to have something else done in that staircase. So again, look at the current controls that you've got in place, assess that current risk with the current measures in place, and have a look at, is there anything else that we can do to contain that spread of the coronavirus? Lifts. You know, many workplaces have lifts. If you're on multiple levels, you may have a lift. It may only be a service lift, in which case it may only be open and available to you know, services. It might be a customer-facing lift. Again, you would want to have measures in place. Are you only going to allow one person in that lift space at a time? How big is that lift space? It may be big enough that you can actually mark it out that you have that 2-meter social distancing. So again, have a look at what's specific to your organization. Look at the measures that you have in place. As I say, at the moment, you may have nothing, which is okay, but have a look at what else you can do to help contain, spread that the coronavirus. Look at open office space. What measures have you currently got in place? What do you need to do to make sure that you can contain it? So again, we've talked quite a bit about that social distancing, you know, where you worked perhaps quite close in proximity to the person sitting next to you. Is that still appropriate? Is that space separate? Do you need to put up a sneeze screen? Do you need to put up those barriers to be able to prevent that spread? Do you need to move people from working face to face to side by side? So again, have a look at your specific individual office space. Look at the layout. Again, look at individual offices. So, you know, we do still have offices where there is one person to a specific individual office. Have a look at what can be put in there. So again, I'll go back to cleaning. Cleaning frequency is something that should be looked at in every single in every single situation. So again, have that in the back of your mind, because it may well be that you might need to increase that frequency. You might need to change the way you do that cleaning. So again, look at those things. It's a backwards and forwards. Current measures in place, current risk, measures that you need to put in place, that action plan, so putting it into action, getting it completed, and then reassessing that risk. The idea is to get any high risks down to medium or low risks. Meeting rooms, you know, again, have a look at what you can implement in changing, implementing measures to contain that risk. Kitchen areas, really, really high usage area. A canteen, some businesses may have canteens. Certainly, with the lockdown, as with restaurants, they're probably closed at the moment. We haven't been given the green light to have those canteens. But kitchen spaces, that, as I said, is a high use area. Make sure that you've got measures in place, controls. You've shared that information with staff. Again, you know, you want people to know that, for example, in the kitchen space, it's one person at a time. You might want to make sure that it's a, you know, anti-bac wipe down when you're finished. Make sure that that information is readily available. It's all fine and well saying, oh, we've got all these measures in place, but do your staff, visitors, customers know what those measures are? So again, have a look at that. Toilets, again, is a high use area. I'm not saying that everybody spends a lot of time in the toilet, but we all frequently go to the toilet. We all go to washrooms, facilities. So again, you know, have a look at it and you know, display signs of what the policies and procedures are, as well as documenting it. So again, one of the action points may well be is download and print off hand washing notice, put it up, assign it to a person. If it's done, it's done. Box ticked. So again, it's having a look at what needs to be done. Without oversimplifying it, take a bird's eye view and have a look what needs to be done, and then action it. Car parking spaces, you know, car parking, again, is there any measures that need to be put in place? Do you have a key card that needs to be accessed? Do you have to punch in a code? Is there a boom that needs to be lifted? Or can you just drive in and out? So again, have a look at it. It might not be applicable, but think about it. Document your thought process. It might be that you don't need to do anything, but if ever challenged, you've got your assessment, you've documented it. Again, first aiders, fire marshals, again, you know, have a look at how, you know, what have you got in place to support your first aiders, you know, in dealing with someone who is perhaps unwell, because the first aid is going to be the first person they're going to be calling upon. What measures have you got in place to protect those first aiders and fire marshals? So again, on the risk assessment, there's some blank boxes. Again, it's there for you to add in anything that is applicable to your specific circumstances. And again, there is an additional notes and information box. So it might be something that you've thought about, but you don't think that there is a specific need to add it anywhere. Document your thought process. You can't be criticized for documenting what you thought, because anybody else picking up the risk assessment will be able to see what you were thinking at the time. You know, quite often you write something down and you think, oh gosh, I wish I'd wrote that. I remember that, but I can't remember why. So again, document it. Document is all I can say, because that is how you will be able to protect your organization. So again, turning to the next sort of circumstance where the coronavirus could be transmitted, is workplace tasks. Now, this is going to definitely vary from organisation to organisation, and the starting point that we have got in there is taking deliveries to your office. How is that going to be managed? Are people still going to just be able to pop in and drop it and get you to sign, or is there going to be a new dedicated location where they need to drop off deliveries? How is that going to be managed? Every organisation is definitely going to be different, which is why there are a number of boxes there for you to fill it in and to carry out that assessment. Don't forget, look at what you are assessing, look at what your existing controls you have in place, score it, give it a level of risk. Don't be shy and thinking, oh, I don't want to have too many reds, I don't want to have too many high risks there. Be realistic and take the appropriate action in making sure that that risk assessment is useful. As I say, look at the probability and the severity of the risk. The scoring is at the bottom of every page. Every page does have additional boxes that you can add to it, and there is additional information. So again, this is a guide. This is not the end of it. This is just a starting point to get you started. So on the final page, before we sort of start getting to it, when the assessor has completed the risk assessment, sign it off, date it. If it needs to be approved by anybody, get it signed off, get the approvers sign off on it. There is also a section where you can, once you've completed it and you want to share it with your staff, again, it's an all-important audit trail. If staff are going to be reluctant and resistant, likelihood they're not going to be signing this, which means you need to go back, speak to them and see what else you can possibly do that is reasonable and practicable in all the circumstances to help facilitate even getting them back into work. So again, all staff listed and signed show that they have been informed and read about the return to work. If they've signed it and dated it, they will have a very difficult conversation to say why they now don't want to come back into work. So again, it's an audit trail. It's about sharing. It's about working collaboratively. It's about getting that information out there. Final page on the risk assessment. It's not the final page. It's the final page of completing from your point of view is, when is the next review date? When do you need to go and have a look at it? So all along, we've got all those action points in place. When do you need to go back and do that review? So be realistic about when that needs to be done, but put a date in their review. If you are carrying out the risk assessment, so it's a second iteration, third iteration, whatever it may follow, put the review date. If there are significant findings that you can still see that there are risks, documented, and create that action plan. And again, make sure that someone actually is assigned to that action and make sure that it does get completed. It is no good if you just put a name and nothing gets done, because that's no help to anybody. It's about completing the entire process. So again, the review is a regular review. You don't need to complete a whole new document. Once you start working with the document, it's a further iteration of that document. As I say, it is a living, breathing document. Feed it, go and work on it, and make sure that you create that audit trail. So finally, that's the end of completing that. As I said, we've got those all important notes, general notes that can help you. What to do when you've got a suspected case of COVID while you're on, on site. What controls and measures you can put in place, general travel and foreign travel information, access, what you should be doing, egress to sites. Again, there's some clear guidance on what to do there. So again, personal protective equipment, PPE. Again, we've got some detailed notes there on what you should be doing, where you can get additional information, where you can get additional support and guidance. Hygiene, poor hygiene, there again are some really useful bullet points. These can be used to use as a checkpoint against what those measures need to be put in place. future measures, updating it again. Use those additional notes. It is a fountain of knowledge at your hands, and we've tried to get as much information as we possibly can in there. Again, we've talked about canteens, kitchens. I've got a whole section there on some guidance, the use of changing facilities, showers, drying rooms. Again, if you have those washrooms, there is some clear guidance there, some websites that you can go to that's got lots of information to help you. The use of buildings, fire, first aid, and I've just spotted a spelling mistake, so I will make sure that I go and correct that. First aid and fire, again, what measures need to be put in place, what support, and again, your home workers. Don't forget about your home workers. Make sure that you have got consideration on carrying out assessments for them. Mental health, again, mental health has affected people in so many different ways. Don't forget to include that in your risk assessment. There's lots of references, there is lots of support and guidance. Again, make sure that training is implemented. There's lots of NHS guidance on training for managers, specific processes and procedures. We've got the links in there. Go and have a look. We've also got the specifics on health and safety law and obligations. So again, it's just a reminder of those normal health and safety duties. And again, there are some fantastic links on the risk assessment. But again, we'll make sure that they are easily accessible. It's down to you to make sure that you have a safe working environment for your staff. So again, I think I've gone through that in quite a lot of detail. That doesn't mean that that is the end of it. Of course, we are here to help you. It doesn't matter whether it is a health and safety COVID risk assessment that you need help and support with. It may well be that actually when you put all this in place, there is other areas where you think you need help and support. HR for UK are here to help you. No business owner should be going through this on their own. There is help and support available, to guide you through this crisis. As I said to you right in the very beginning, my vision is to make sure that businesses come out of the coronavirus crisis successfully, and our help and support is there. So we have got a specific coronavirus crisis package. It is not a one-size-fits-all. It is tailor-made specific to your business needs. Depending on what you need doing, we will tailor-make a package specific for you. It's a one-off package where you get the help and support that you are going to need, whether that is going to be perhaps getting staff back into work, whether it is carrying out and helping you with that support, with that risk assessment, whether it is at phased return to work, whether it is perhaps considering using the flexible furlough scheme. How am I going to use that flexible furlough scheme? There's so much guidance that's come out, but I actually want someone who's going to go through the journey with me. I want someone who is going to hold my hand, help me talk through the crisis, help talk through my current situation, help me find a solution that's suitable for my business. I want someone who is going to go through that journey with me, help me and guide me. Then our crisis package is for you, because we will go through that journey with you step by step of the way to make sure that your business comes out of the crisis successfully, because that is the key to making sure that you survive this. And sometimes needing someone else to help you in that thought process, to help you document that thought process, and to help you with that one-to-one support that we need in this situation where it's unprecedented, it's uncharted waters, but having someone go through this with you will make it so much easier. So to get in contact for more information on our coronavirus, please do go to our website. It's www.hrforuk.com. If you want to send an email, our email address is info@hrforuk.com. If you want to give us a call, that number is 01455 444 222, and we will be more than happy to help you. As I said, it's not a one-size-fits-all. we are here to help you. Just a quick reminder, we have our free Friday afternoon webinars. Please join me again on Friday, depending on when you're listening to this. Will depend on what my Friday webinar is, but absolutely every Friday, our free webinars, 3 to 4. Don't forget to register for those, and I look forward to seeing you at our regular webinars where you can put in those all-important questions. Just one final reminder, we are having a paid-for webinar in relation to carrying out a redundancy. So this is, again, just a bird's eye view on the process of carrying out redundancy, with some top tips on how to make sure that you don't fall foul of the law and where not to cut corners. We do have some supporting guidance on that. So again, we do have the paid for webinar. It is a little bit more than just the information that I give out at my usual Friday afternoon. So if you are thinking about making redundancies, I would strongly suggest that as a refresher, at the very least, you invest in yourself, you invest in your business in taking out that paid for webinar. It is got lots of top tips to keep you on the right side of the law. But again, as I said, if you want somebody to go through the journey with you, our crisis package is tailor-made for you. So that's enough from me. I think I've kept you busy for long enough. Enjoy the rest of your day, and thank you very much for listening. Bye for now.